Well, our team prepared for COVID in many ways. I think when I specifically talk about nursing, I'm talking about the entire healthcare team. We all came together in such a way to support each other with new education, trying to prepare ourselves to understand what PPE requirements were, to understand how we could help staff in other areas that we weren't familiar with, and how we educate each other and educate the staff on how to take care of patients that may be outside of their normal home unit. So it really was a complete team effort of pulling together, consistently sharing information, learning the changes that were happening day by day, and they really did just work along each other just like they had their entire lives. They did such a good job of welcoming each other, pulling together, taking care of our patients, and really giving them the best possible outcome. And so I was really proud of how they all came together to support one another in a really tough, difficult time. What I want our community to know is that they're absolutely safe in our care. We are so prepared for anything that comes our way, whether it's a pandemic or a natural disaster, whatever it may be, we're always at the ready. We have plans in place that address how we're going to respond to all these situations, and we're so prepared that our community can know that they're going to be safe in our care. Well, during the pandemic, what I've learned about myself as a leader during COVID is that you have to be flexible. Change is inevitable and growth is optional. So as a leader, we have to take that option to grow and to learn and to mold and shape into what our employees need from us, what our community needs from us, and every other partner, just our local community needs. And so for us, we have to be flexible, adaptable, and willing to grow and learn. And so that way we can stay prepared for the next thing. We can stay prepared for the next pandemic. We can stay prepared for the next situation or event that comes along. And so as a leader, it's just knowing how valuable flexibility is and how valuable growth is, and self-awareness, that you know that you need to continue to grow to be a strong leader for this community. So during Nurses Week, we didn't really get an opportunity to celebrate like we normally would have. And so it was really important that we listen to the voices of our frontline staff and nurses about how they wanted Nurses Week to go. Because of restrictions, things like that, we weren't able to come together to celebrate as we usually would. And so we took it to our council. So that's part of shared governance, and that's part of how we manage day to day, hearing the voice of the frontline. And so they came up with the idea themselves. They've supported us, they've brought us food, they've written signs on the, written notes on the sidewalks, and they've really been so supportive of us on social media everywhere across the country and locally as well. We wanted to find a way to thank them. That was their first response. And so for me, it was really a great sentiment of how much they care about their community and how much they were really focused on saying thank you to them, because they had reached out to us in a really difficult time that was very unknown. And so I think for them, it really came from the front line about their commitment to this community and just, how can they say thank you? And so the things they did by taking it back to them and putting signs out and just, driving by organizations to say thank you meant so much to them as well. Well, nursing has always depended upon all departments to provide high quality care. And during COVID, we really had to depend on our infection prevention department. And the infection prevention department is ran by infection prevention nurses, and they had to collaborate with physicians, with our environmental services workers, our food services, so they could understand how to safely continue to do their day-to-day role and be mindful of COVID and transmission. So they really, infection prevention nurses really reached out all across the community and worked with Dr. Stewart to ensure that we were providing safe care, that our staff were safe, that all these other areas that we collaborate with day to day, but this was on a totally different level. It was about education, it was about support for providers, for many different industries within Knox County and even outside of Knox County. So we did a really good job of taking those infection prevention nurses, and they really spread out across many different avenues to help educate and support. I think it brought us all together closer as a team, because things changed so quickly, and we were able to communicate with each other quicker, and we realized the need to communicate in that fashion, even more so with COVID. And so I think it's just given us a level of trust among all of our departments about how we're going to be there for each other regardless, and how we're going to support each other through whatever may come our way. Well, I think one way that we really had to evolve and use technology during the COVID pandemic, and as we continue to have some visitor restrictions at this time, is the use of technology as far as iPads, other devices, and mobile devices that we've used for families to communicate with their loved ones and patients for them to communicate with their families. One really cool, innovative thing that we never thought would happen is, we'd use an iPad to FaceTime or to Zoom other families, but we didn't expect that a patient of ours would have a appointment with a specialist and that was out of town while they were hospitalized. And we were able to FaceTime in that physician, that specialist, from another location, from another hospital, for them to have their appointment, and their family was able to participate in that conversation as well with the specialist. So we used it in many different ways. We had telehealth, but from a nursing standpoint, we use it as a communication device, but more importantly, it extended beyond loved ones and family, even into specialists, so we can make sure they got the best possible care and that they were continuing to be cared for by their other providers. So I think we continue to use that innovation on a regular basis now. It's become part of our day-to-day, and I think we're going to continue to use it from this point forward.